Good evening, everyone. This is a small topic on Die Another Day. I was presenting 28-year-old gentleman, Mr. K, who presented with deliberate self-harm attempt. He consumed supervasmol dye, 100 ml bottles into 2. He presented with, he was found drowsy with excessive salivation from the mouth. There was no history of nausea, vomiting, abdominal pain, but he gradually developed hoarseness of voice and breathing difficulty, and this is how he was noticed by his family. There were previous attempts of DSH on taking the history, but they were not revealing details about the same. He was occasional consumer of alcohol, and this current attempt was along with alcohol consumption, no other known comorbidities. On examination as a young gentleman, he was obese, he was restless, he was tachypneic with a respiratory of 36. The vitals, pulse rate tachycardic, saturation was only 88%, show strict sign was absent. He had gross cervicofacial edema. He had an audible stridor, and we also noticed multiple hesitation cuts over bilateral forearms. Cardiovascular respiratory examination was otherwise unremarkable, and abdomen examination was normal, and CNS wise he was drowsy but no focal deficits, and pupils were equal and reactive. The pictures are for illustrative purposes only. We couldn't take an image in the casualty, but we just wanted to highlight he had dark colored urine along with severe facial edema involving the eyelids, involving the cervical region, along the neck region, and along the angioedema of the lips. This is our protocol which we have in place for the CMC in the CMC internet site about supervasmol poisoning. So I want to highlight a few things here. One, the toxic components: PPD, resorcinol, EDTA, propylene glycol, and these are the four main manifestations seen in patients with supervasmol poisoning: cervicofacial edema, rhabdomyolysis. They can they can have hypocalcemias and renal failure. So in our case, this patient had presented with he had cervicofacial edema, he had features of rhabdomyolysis, urine was dark colored, and clinically Chau-6 was absent. So how we managed the patient? We were able to intubate him in casualty itself without before ENT had actually come into place. He was given a hydrocot 100 mg stent, Senline was inserted and was rushed with fluids, and the rest of the investigations as they sent. Calcium, CPK, RFT, and urine analysis was sent. And this is what the investigations were reported as. Creatinine 1.24. There was transaminitis 275/52. Urine showing RBCs of 12 with blood of 3+. His initial calcium was normal 8.65. CPK was 4,963 with a myoglobin of 26,090. His ionized calcium was also on the normal levels 1.1, as you can see. So this person was diagnosed with deliberate self-harm attempt, supervasmol dye. He had two of the main complications: cervical facial edema with stridor and rhabdomyolysis. He was shifted to ICU for further intensive care. And just a short, what happened in ICU, he subsequently underwent tracheostomy and continued adequate fluid resuscitation from casualty to ICU. Monitoring output, his creatinine actually improved, and CPK showed a declining trend and did not require any dialysis. During the course, he also developed ventilator-associated pneumonia while in the hospital, but with the course of antibiotics, he was afebrile. He was discharged on tracheostomy with room air, and psychiatric consultation was sought for the impulsive act with high lethality, and started on medications for the same. The highlight of today's presentation is supervasmol poisoning. Now this is synthetic dyes. This started in the creation of this started trace about to 1856, and permanent hair colorants have been in commercial use for more than 100 years. And PPD, which is present in this, is one of the key ingredients for most of the hair dyes and is used for color enhancement. The concentration varies among a lot of these compounds, from 70 to 90% in the older stone hair dyes, and 2 to 10% in most of the newer hair dyes that we use, and which are used for giving it black color to the hair. Exact concentrations are usually not revealed by the companies because it's formulations are proprietary. So this patient, the usual three manifestations as we mentioned earlier: early angioneuritic edema of the neck and face with stridor, rhabdomyolysis going to ARF, and hypocalcemia. Just a little bit into how each one of them comes into play. As I said earlier, PPD is a main one of the components in it. Now the PPD provokes one of the most prominent edema, and it's supposed to be very specific and localized to the head and neck region, that is cervicofacial edema. Why this happens is because in the mucus, when it comes in contact with the mucous surfaces, it becomes oxidated to the product quinidamine, which is responsible for the local intense irritation which is causing the cervicofacial edema. rhabdomyolysis. Now this is because it promotes calcium release and continuous leakage of calcium from the smooth endoplasmic reticulum, continuous contraction of the muscle, and causes irreversible changes in the muscle structure. And this myoglobin which go and attack, myoglobin cast will form within the renal tubules, causing acute tubular necrosis and AKI. Hypocalcemia, two reasons. One, it can be secondary to the hypocalcemia. Two, the EDTA which is present as this one can cause chelate the calcium and cause hypocalcemia. How severe is it? How severe is usually the presentation? They have noticed in 19 patients over a study in Tunisia, 79% of them developed cervicofacial edema after consumption, and 74% developed some chocolate color urine, 68 developed airway tract edema, and rhabdomyolysis and metabolic acidosis were seen in all the patients in their study. This is why mainly I wanted to highlight this one. We have a study from our institution regarding the same, and following sir and ma'am and all were part of this study. In this study, mean age of the patients who presented were 27 years, most of them South Indian women who are housewives. The mean amount ingested was around 150 ml, and the mean time to arrival to a hospital was 32 hours, which you understand ours is a quaternary center, so people usually go to other places and referred when they have used up the resources. Now what we studied was among the people who had adverse outcomes and those who were alive, what was the factors that led to each. So one of them you can see here is hours to presentation to a hospital. The adverse outcome 45 hours and 33 hours. Gastric lavage done at a primary center. The adverse outcomes were, who had underwent gastric lavage were mostly alive. Who were underwent tracheostomy outside, adverse outcomes, but probably that can be, it's not a confounded study. GCS for low presentation was also underwent adverse outcomes. Other things were serum creatinine, serum bicarb, and CPK at presentation. That's also very significantly high. Not significant, but anyways you can see the trend. So the trends towards a poor outcome, late presentation, gastric lavage not done at a primary care center, those who have been intubated outside, or a low GCS. There's also a trend towards higher CPK and creatinine levels at admission. Now, how long does the clinical manifestation usually take? Most of them happen within 6 hours. Mean time is 1 hour 30 minutes to 9, from 1 hour 30 minutes to 9 hours. Mean time is 4 hours and 30 minutes. This study, after being published here, and a lot of studies that were started publishing, the company was made aware of these case reports that were coming up, and literature reviews were reviewed by them, and there were news reports of the fact that there were there were no news reports. I tried searching into it, there was no news articles, nothing came up on paper, but there was a constant decrease in the concentration of the PPD in the further compounds that were made, the further batches that were made, and the incidence of supravasmol with clinical features has actually significantly reduced after that. But there was no prevalence studies which I could highlight how it has decreased. But I think from our experience wise, from what people used to see earlier, from what we have seen now, we have seen a much fewer number. I've also tried contacting the company for details regarding what the changes, but they said they do not reveal the details regarding the percentages. But there was one of the articles showing the PPD in the supravasmol is less than 4%. Now, interesting story into how our patients survive. In the initial first referral center itself, he had received injection adrenaline IM, hydrocortisone IV, and also received nebulizations, probably adrenaline, not sure. And in our center itself, forced diuresis was initiated very early in our center. So the benefit of our study concluded hydrocortisone and antihistamines can be used to treat cervicofacial edema. However, there are no therapeutic trials to show the benefit. Early institution of forced diuresis and maintenance of high output can prevent ARF and rhabdomyolysis. Dialysis per se is purely supportive because the toxin is not dialysable. So take home message 1, clinical outcomes rely on early recognition, prompt referral and aggressive treatment, and awareness about the toxicity and what we can do in early setting so that the patient can survive in the longer run.
Thank you. Any questions?
No, creatinine improves. Urine output never dropped, never oligotic.
So that's an unusual thing because most of the patients now is that severe supravasmol. So one of the main problems is that clinical failure which requires strong dialysis.
Yeah.
It's very common poisoning and the patients require cleanup when more or less. So what happened was that Omicron was came was that. So they published this. And we got this call from the company saying, can you come and see it? They don't actually publish it very often. They will come. They came and they showed us the publication. That what is all this stuff? Putting a bad name for our company. So then we also researched what is the compound that is actually causing toxicity. And it was a PPD. So we asked them how much PPD is there on this thing. It's actually 4%. So they wanted to do studies to look at what is the percentage of PPD which is safe. So they did some animal studies and they found that it could reduce the percentage 2% without actually altering the coloring. In Western countries they use some 1% of PPD. So they reduce the PPD concentration. We did see following that there was less number of cases, but whether that actually indicates that there was less amount of superplasmon positive across India, we do not know. So we interested to look back and also to follow up with the company whether the PPD concentration is still low or whether it is not. But I think that advocacy with industry, we try and make sure that chemicals that are available out there in the market are safe for public. We learn something.
Thank you. Are there any systemic absorption of the PPD on local application? I mean, has that been kind of looked into?
Didn't come across. We read up on the systemic. I mean, there are systemic side effects. Most of them is mucous membrane affected. I couldn't read up on the systemic effects. The other things have the resorcinol and other compounds have systemic effects. They can directly. Sorry, PPD also has direct renal toxicity effect also, sir.
So whether somebody is using it chronically, whether that has any chronic effect, I'm just thinking whether anybody has looked into it. And
Not
so the recommendation is to keep the percentage less than 2%.
as low without causing. Yes.
And I mean, increasing the concentration, does it have any extra advantage in hair looking more blacker or lasting longer? I mean, or is it just is the one that gives you the black color?
Yeah, that it's an oxidizing agent which lies in the hair. It acts faster and preserves it for a longer period.
And by reducing the concentration, is there any decrease in the dyeing capabilities of that? Any reason for them to keep it high?
Same.
Didn't.
And the company did not know the lethal toxicity, so they, because of the publication from here, they were made aware of, and they took the trouble to come here and find out and do studies, get to the fall and the PPD concentration without altering the derivatives that guide
Change.
Good. I think it's a good translation study. Sue, you wanted to?
No, this is injection. This is injection. Yes.
My question is whether locally does it get absorbed or chronically? So just a question.
We haven't found any problems. I mean, all over the world, everyone is using a hair dye except me. Because of the problems that we see with hair dye,
Sure.
can cause a lot of irritation and even cause many dermatitis. So that's the reason why we tell them not to use it. Now there are a lot of vegetable hair dyes, and that's kind of flooding the market. So many people are changing to vegetable hair dyes. I use over the years.
Okay, thank you.